The Prevention Research Center is a CDC-funded research partnership between the University of Michigan and communities throughout the state of Michigan. One of our main focuses is to work on health disparities. And so we go into those communities most affected by those disparities and ask them to partner with us to help create safe and healthy futures. We work on a range of health issues that focus on prevention and health promotion. Youth violence prevention, sexually transmitted disease prevention. We work on topics such as obesity, infant mortality. We've worked with our community partners on a capacity building project.
One of the most important aspects of our work with the PRC has been to do what we call the Speak to Your Health survey. It provides basic evaluation information about different health risk factors here in Genesee County.
One of the core research projects is HOPE. HOPE stands for HIV Outreach, Prevention, and Education. The intent is to help them to understand more about HIV and STIs so that at the end they will be prompted to get tested and also to create an individual level plan for how they're going to keep themselves safer.
The Youth Empowerment Solutions Program is a program that teaches youth between ages 10 to 14, and we teach them about bringing change throughout their community. Through the curriculum, we try to teach them about assets and liabilities in their community to bring about change in their community.
Our goal here today with our garden through the YES program is to teaching our kids legacy, leaving positive things that they can have their kids come back and see.
People, like little kids, can come down and like sit down in the garden and read books and stuff on the benches and making it so it's not just affecting us but other people.
The Youth Violence Prevention Initiative is another great example where the Prevention Research Center has brought resources into Genesee County and Flint to help us look at how we can reduce the problem of youth violence in our community.
We are creating a base of knowledge that can be translated to communities around the country and presumably the world to try to change and move the needle on health disparities.
Flint, Michigan is my home. It's the place where I live, it's the place that I was raised, it's the place where my family is raised, and we have generations here.
When I grow up, I want Flint to look like a beautiful city where kids can run around in the streets without nobody being scared.
I still think that Flint has potential. I want Flint to be a better place. I want it to go back to the place where it was a top 10 place to raise a family.
The kids we're working with are growing up in very disadvantaged communities. And so they have many barriers to succeeding, to success. And so another factor that we're interested in is helping those youth be resilient.
One of the great things about partnership with the PRC, it helps us build relationships throughout the community so we're able to reach more families and more youth throughout the city of Flint.
There are a number of great things about partnering with the Prevention Research Center. One of them is the fact that it brings resources into our community to help us address some of the public health issues in the community.
Communities really learn how to benefit, they learn how to put programs together, they learn how to do the research on those programs, they learn how to provide services that are effective in helping to reduce whatever disparity the community has identified.
From the initiatives, to the measurements, to the collaboration, all of these activities and these steps are vital in getting us to that healthy and sustainable future in Flint that we all want and deserve.
The YES program taught me about the possibilities that you can do in this community. Like, you could work, you could be a leader, or you could learn and stay off the streets.
One thing I always remember is coming together in the group of YES and just thinking of ideas to do, walking around the community and seeing how to improve it.
The YES program taught me how to keep the community nice and clean and how to stay off the streets and stop the violence.
We try to touch as many lives, change as many people as we can, because we know by doing that, we'll eventually gain the momentum that's necessary for changing community health and reducing disparities.
Having a voice in the change in my community makes me feel proud. Like, as a 13-year-old, I have the opportunity to help and make my home a better place. I don't want to grow up in Flint knowing that it's going to get worse and worse. I want to grow up in Flint trying to make a better place, then it will be a safe and healthy environment.